it was my daughter witnessing one of my beatings that made me realize, wow, I have to do something about this. You know, I'm getting more depressed, I'm getting worse. The assaults aren't stopping, the violence is getting worse. And so I decided to swallow 3 bottles of pills and tried to end it. And by some miracle, somebody found me and saved my life.
Specifically, the research that I focus on is the effect of parental depression on child outcomes. So what we found is that children of depressed parents are at increased risk of psychopathology. But more importantly, what has been found more recently is that when parents go into remission from their depression, the children actually improve. So we want to replicate those results. So we're investigating here effective means to treat the parent's depression and how that outcome affects the children.
So I was about 6 weeks postpartum, and I woke up in the middle of the night and I was sweating and I started to shake, and I thought, I'm dying. There was one doctor I remember in the emergency room, years later, saying to me, you're having anxiety attacks. This is what you are having. These are panic attacks, and you need to get help with these because they're going to get worse. The difference between taking a pill and taking cognitive behavioral therapy and learning it and using it is that cognitive behavioral therapy lasts. Drugs have a shelf life, and when they start getting out of your system, you need another one, and then another one, and another one to keep you at that level.
Research has actually shown that when people do a trial of cognitive behavioral therapy, and you take brain scans before and after therapy, that the brain actually does change. So the skills, the techniques that people are learning during treatment translate to important neurochemical and neurophysiological changes. The goal is always more people getting better faster and also remaining well.
There's no history of depression or anxiety in my family. There's all bad heart and diabetes, but no history of, and I had never had a history of, I didn't even know what depression and anxiety meant, really. I was amongst the masses who just think, oh yeah, whatever, flip a switch, make it go away. Within 2.5 years, I had become so stressed from the work environment. There was nothing that I could do that was meet the requirements. All of a sudden, it was as if I had no mind and I had no objectivity or no common sense about the position that I had held for the last 9 years. I had never had a bad appraisal in my life, still haven't had one, but yet it came to the point where I would drive into the parking lot and I would cry before I'd even enter work, wondering what was going to happen to me today.
Many depressed patients have early life events, and these life events are then triggered when they are in adulthood and when they undergo a depressive episode. So somehow, and we don't know that yet, somehow in the brain and its intrinsic activity, these early life events somehow seem to be encoded, but we don't know yet. So in layman's terms, they leave a trace.
My vision of a center of excellence is that wouldn't it be nice if you were suffering from mental illness, if you're suffering from depression, you walk into those doors and you have people that'll do all the blood tests that are necessary that may help you. They may do the brain scans that may help identify where and what your diagnosis might be. You may have genetic analysis done so that we will be able to select the proper drugs and treatments for you. And so this is what I mean by a center of excellence, where you go in there and your problems are dealt with in a very systematic and a very particular way to get you better faster, to get you back into the workforce, and to kind of get moving with your life.